Hi, I'm Sarah Cox, a clinical psychologist and the manager of the Butterfly National Helpline. I'm here to talk about bulimia nervosa, what it is, the warning signs and risks, and how to get help. What is bulimia? Bulimia nervosa is a serious and potentially life-threatening mental illness. Someone with bulimia will experience repeated binge eating episodes where they eat large amounts of food in a short period of time, followed by compensatory behaviours like vomiting, excessive exercise, fasting, or misusing laxatives or diuretics. A person with bulimia can feel a sense of loss of control and be unable to stop themselves eating, followed by feelings of guilt and shame. This can lead them to engage in compensatory behaviours to try and control their weight. These behaviours can become more compulsive and uncontrollable over time and lead to a preoccupation and negative relationship with food, eating, weight, dieting, and body image. What are the warning signs and risks? Bulimia does not discriminate, and people of any age, weight, size, shape, gender identity, sexuality, cultural background, or socio-economic group can experience this illness. There's no single cause of bulimia. It is often due to a combination of factors including genetic, psychological, and cultural influences. Signs that someone is experiencing bulimia can be different for everyone. Bulimia can be particularly hard to identify, as someone with bulimia often goes to great lengths to keep their behaviour a secret. Some of the most common warning signs and symptoms include physical signs, like frequent changes in weight, signs of damage due to vomiting, like swelling around the cheeks or jaw, calluses on knuckles, damage to teeth, and bad breath, feeling bloated, constipated or developing intolerances to food, loss of periods, fainting, and fatigue. Psychological signs, like a preoccupation with food, body shape, and weight, low self-esteem and feelings of shame, self-loathing or guilt, particularly after eating, feeling out of control or unable to stop eating, extreme body dissatisfaction, and distorted body image. Behavioural signs such as hoarding or hiding food, frequent trips to the bathroom during or shortly after meals, which could be evidence of vomiting or using laxatives, eating in private and avoiding meals with other people, spending more time alone, obsessively weighing and looking in the mirror, secretive behaviour around food, excessive exercise, dieting, and erratic behaviour like spending large amounts of money on food. Without treatment, bulimia can result in serious medical and psychological consequences, including chronic sore throat and indigestion, inflammation and rupture of the esophagus and stomach ulcers, osteoarthritis, heart problems, infertility, as well as increased risk of self-harm, substance abuse, and suicide. How to get help? Recovery from bulimia is possible, even if you've been living with the illness for many years. Whether you're worried about yourself or someone you care about, having a conversation is an important first step. We know that seeking help early can reduce the severity and duration of an eating disorder. If you're not sure whether you're experiencing bulimia, use Butterfly's screening tool to help find out if you or someone you care about is at risk. It's important to share your concerns with a GP, healthcare professional, or another trusted adult. Butterfly's referral database can help to find a health professional with experience in eating disorders and body image concerns. The Butterfly National Helpline is also here to offer free and confidential support for anyone in Australia who has concerns about eating disorders or body image issues. 7 days a week, 8 a.m. to midnight. Call 1-800-ED-HOPE. That's 1-800-33-4673. Or visit butterfly.org.au to chat online, email, or access more information. Remember, you're not alone, and talking helps.